St. Mary's Healthcare System for Children is a unique player within the pediatric healthcare arena. We take care of children after they've been in the hospital, when they need ongoing care, mainly children with complex medical problems. The state of New York recognized that there was a specific need for a home care agency that could focus on this unique and needy population. And St. Mary's has been able to meet that need over the course of the last 6 or 7 years. It's a wonderful program with specialized nurses and therapists, including physical therapists, occupational therapists, speech therapists. We provide holistic care within the children's homes for as long as they need, for some of them for their entire childhood or even into young adulthood. We serve over 1,000 children in the 5 boroughs of New York, Nassau, Suffolk, and Westchester County.
St. Mary's Home Care is geared towards the home environment. Everything that has to do with their goals has to do with home. So whatever a patient has difficulty with doing at home, we're there for. Getting ready for school, being able to eat breakfast in the morning, getting their orthotics on, all those things to do before you get out into the world.
When St. Mary's told us that Ashley can come home and work on her therapies at home, we were ecstatic. But we were also nervous because she spent months in St. Mary's with nurses around the clock that were watching her to ensure that everything was going smoothly. To have her home was nerve-wracking at first. And when it was time for Ashley to be discharged, they told us exactly what it would look like, and exactly what they said is what would happen. Within 24 hours of Ashley being home, she had a nurse that called, and they walked us through everything the whole way. They were amazing.
While we're in the home making our assessment, we're able to notice things that aren't obvious in the hospital to the caregivers. We're able to provide safety assessments to see if there's any adaptations that need to be made. To provide a safe environment for the child, we're able to go over the medication to see if the parent is giving them correctly, to see if there's any unmet needs for the child in the home. At St. Mary's, we also have a telehealth program, which is able to provide telephonic outreach to families.
We enhanced our home care program to include an interactive voice response system. It's a unique solution where families receive an automated call. They answer a series of questions, and basically if they've had a change in their health status or require a visit from a home care nurse, we could go out and visit the patient, follow up with them to really find out what the issue is.
We've been forward-thinking in providing telehealth to our patients as an enhancement of the services we provide, and the telehealth nurse is really another link to them with our nurse to try to pick up when issues or problems are arising and to try to address it at that level.
Okay, so I will follow up with you in the morning and I will let her nurse know. Okay?
Every week, telehealth gives me a call. So if I really need to speak to a nurse, I press the button and within an hour they call me back. Whenever I need them, they're there for me. It's good for everybody.
Our goal in utilizing technology is not to replace the day-to-day personal care that we're providing, but rather to enhance the care that we're providing in the kids' homes, to be able to respond quickly to changes in what's happening, to be a support system for the parents.
People want to be home. If they can get quality care like they would in a hospital and get it at home, who wouldn't want that?
As a parent, your child is your everything, and that we can give her the best life we can. That's what matters for your child.